BiPAP stands for Bilevel Positive Airway Pressure, a crucial tool for patients struggling with respiratory failure. It delivers two distinct pressure levels, a higher pressure during inhalation and a lower pressure during exhalation. This dual pressure mechanism significantly reduces the patient's work of breathing while providing essential support.
In COPD, BiPAP is vital for removing trapped carbon dioxide and correcting respiratory acidosis. The higher inspiratory pressure improves alveolar ventilation, allowing the lungs to flush out CO2 more efficiently. Simultaneously, the lower expiratory pressure maintains airway patency to enhance the patient's overall oxygenation levels.
BiPAP is commonly used in COPD exacerbations and moderate to severe respiratory distress to stabilize the patient. By improving both ventilation and oxygenation, this non-invasive intervention can often prevent the need for mechanical intubation. Follow for more nursing basics on oxygen therapy and acute respiratory care.